Greetings from Citizen Health and the Team Academy IAPSME Connect. And today, in the series of People's Health It Matters, we have Dr. Vidya Jeevan, Preventive Medicine Specialist from Bangalore. A very warm welcome to you, ma'am, on behalf of all the audience.
Thank you, Ritu, for having me in this meet. It's a great honor for me to be a part of IAPSM meet.
Thank you so much. And today it is a very important day because we are going to talk about such a topic which is not very commonly talked about. And let me tell you all that the topic is mental health in transgenders. Is it right, ma'am?
Yes, I want to talk about mental health among transgenders today.
Okay, that is very great, and I am very sure that this session is going to be very interesting. So, I would like to start with the session that why you choose this topic, ma'am? Why you think that mental health is very important, especially in this COVID pandemic?
Yeah, see, Ritu, mental health is a need of the hour, especially in the times of pandemic. Mental health is a growing global challenge which impacts individuals, families, and communities everywhere. Understanding and destigmatizing mental health should be a priority in times like today. First of all, let me tell you what is mental health. So, mental health is the ability to cope with daily stresses of life, realize our potential, and contribute to our community. It includes various components like emotional, psychological, and social well being. According to the World Health Organization, 1 in 4 people are affected by mental disorders. And during the time of pandemic, this has increased further by around 20%. Even though a lot of effort has been taken by the government, non-governmental organizations, and private agencies to create awareness regarding mental health, there is still a lot of stigma associated with mental health issues. People are still not open to sharing their mental health problems either with family or their healthcare providers due to stigma and discrimination associated. Marginalized sections of the population are the ones most hit by stigma to mental health care. Amongst them, transgenders have the double burden of oppression thrust on them as they are alienated by the general population due to stigma and gender discrimination. This is the reason why it is very important for us to understand mental health in general and mental health among transgenders in particular.
Very true, ma'am. That when we talk about transgenders, it is really alienated by the society. So, I would like to know that who are these transgenders?
So, Ritu, transgender term is an umbrella term for identifying all those individuals who have discordance between expressed gender and gender which is assigned at the time of birth. Okay, a transgender woman is somebody who had male genitals at the time of birth, identifies now as a female. A transgender man had female genitals at the time of birth, but identifies now as a male. So they constitute around 0.3 to 0.5% of the total global population, that is around 25 million. And in India, we have around 7 to 8 lakh transgender individuals.
Do you think that they become as like it is a god's creation, or they become as they wanted? It's like psychological problem or what?
Yeah. So this is a very important question, Ritu. Most of us think becoming transgender was their choice or it is some kind of mental health issue, but it is not like that. There are various factors which play a role here. It could be a result of genetic predisposition. Studies have shown that it can run in families. Okay. And it could be a result of various biological factors. For example, if there is any imbalance in the chromosomes or hormones, it can happen, or it also can be a result of severe forms of childhood adversities and neglect. It could be a result of physical abuse, sexual abuse, or even mental abuse. Okay, and also role of endocrine disruptors like palates is being studied.
So why you think that mental health in transgender genders is important? Why we are talking about it?
Yeah. See, it is not that all the trans individuals experience mental health issues. Some trans individuals don't experience mental health issues at all. Others have mental health issues that aren't related to being transgender. But for some, mental health and gender identity are related. See, as such transgender persons face challenges related to discrimination, negative attitudes among the public. And mental health issues are also associated with stigma. So it creates a kind of double burden on them. And researchers suggest that transgender individuals are almost 4 times as likely as cisgender to experience a mental health condition. So cisgender is somebody where there is no discordance between the sex which is assigned at the time of birth and gender which is expressed in the later part of life. And as per the World Health Organization also, transgender people often experience disproportionately higher levels of mental health conditions and also substance abuse. So you can take any disorder, depression, eating disorder, suicidal tendencies, anxiety disorders. They are twofold to threefold more among transgenders compared to cisgenders.
Then why is it so, ma'am? Why it is more common in the transgenders?
See, there are various reasons for this. The most important one would be because of discrimination, mistreatment, and stigma which they face. See, transgender individuals are often unwelcome at home, school, workplace, or even social settings. They are the victims of verbal harassment, physical attack, and even sexual abuse. So this is one of the most important reasons why they are more prone for mental health issues. And other reason could be not having enough family support. Okay, not having family which is very supportive of their gender expression. And also there's a wide variety of barriers to healthcare in accessing general as well as specialist services, including sexually transmitted diseases. There is also a dearth in availability of gender transition services in India. So it can also make them more prone for mental health issues. Finally, yet importantly, the information related to social functioning and mental health needs of these individuals is also limited, which further makes this particular population a vulnerable one.
So, what are the common mental disorders if we talk about, like some examples, ma'am?
First and foremost, I would like to mention gender dysphoria. Let me explain a little bit about it here. So, as soon as a child is born, we are going to assign a gender. That's the first judgment we are going to make, right? In humans, along with this, various other psychological and social factors have a major additional influence on behavioral outcome with respect to gender. For example, it could be verbal labeling. Example, we are going to repeatedly remind the child that you're a boy, you're a girl, and non-verbal gender cueing. For example, giving them gender-specific clothing or haircuts. Okay, and shaping of children's gendered behavior by positive and negative reinforcement. For example, if a boy wears girls' clothes even by mistake, we are going to correct that immediately. And if a girl picks up toys which are meant for boys, we are going to discourage that. Defining gender roles in the later part of life. For example, if it is a boy, we say you need to become financially independent and we put too much pressure on that particular child. If it is a girl, we try to involve them in household chores. It may not be true in affluent societies, but it is practiced in most parts of India. Added to this, if there is a mismatch between biological sex and gender which is assigned at gender which is identified by themselves in the later part of life, a kind of psychological distress will be happening. This is called as gender dysphoria. So gender dysphoria is not a mental disorder per se, but it can contribute or exacerbate other negative mental health outcomes. And the other disorders include depression, anxiety. It is said that approximately 30 to 70% of the individuals had a lifetime diagnosis of depression, and approximately 3 to 30% of the individuals had a current diagnosis of anxiety disorder. And if you take the risk of suicide also, it is around 20 times more among transgender individuals compared to cisgender. And substance abuse also. So they may try to ease these psychological distress by getting involved in harmful behaviors that results in substance misuse. And the other disorders we can see among them are borderline personality disorders and bipolar disorders.
So, how to find support, ma'am? If
Yeah, see, first of all, we have to remember that getting support and assistance from a qualified provider can bring healing and help them to live a healthier and a fulfilling life. And joining advocacy groups where they may feel welcome and establishing connections with other transgender individuals in the society and seeking therapy when it is required. First of all, a lot of awareness has to be created among transgender individuals on how to explore their identity, both socially as well as medically. It could be use of even hormonal medications or gender affirmation surgeries, and how to navigate relationships with friends, loved ones, and co-workers, and healthy ways to cope with stigma if they encounter any, and how to manage unpleasant feelings using stress management techniques, medications, or other methods. And also, there are various national organizations, trusted national organizations, and non-governmental organizations in our country. so, which are working towards them. So taking help from them, and also making use of national suicide prevention line, which is active 24/7 if it is required.
Is there any law also to support them?
Yeah. So we have an act called Transgender Persons Protection of Rights Act, which was implemented in the year 2019, and I think it came into effect from 10th January. So various issues have been addressed under this. They've recognized transgender as a third gender under this, and discrimination against transgender persons was prohibited, and reservation for transgenders in jobs and educational institutions. In fact, Karnataka is the first state to do this, and establishment of complaint officers to handle complaints from transgenders, and to set up transgender protection cell to monitor offense against transgender persons, and to formulate welfare schemes, insurance schemes to cover their medical expenses. Hormonal medications and gender reassignment surgeries can be expensive, so having insurance schemes for such things, and also to set up human immunodeficiency virus centers. Okay, all these issues are addressed under the Act. If I have to talk about the constitutional rights of transgender people, Article 13, Article 14, 15, and 23 addresses rights to equality, prohibition of discrimination on the ground of religion, race, and prohibition of trafficking, okay, human trafficking. And also, I would like to mention here about the landmark judgment which happened in the year 2019 by the Madras High Court, the Section 5 of Hindu Marriage Act, where they interpreted the term bride and they included transgenders as well on the day of a wedding. Yeah.
Okay, so before leaving this session, ma'am, I would like to take two messages from your side. First, I would like to know that how transgender can take care of their mental health, and second, what can we do as a society? What can we do for them for their mental health as well as other things?
Yeah. So it is similar to any other person. They have to get involved in regular physical activities. It could be yoga, meditation, and eating nutritious diet. Okay, and implementing newer hobbies in their lifestyle, and implementing new hobbies in their lifestyle, and socializing, sharing details about their life with someone whom they can trust, and being aware of warning signs. If they're frequently feeling sad, getting negative thoughts, suicidal thoughts, or persistently feeling anxious, they have to consult a healthcare provider whom they can trust. And avoiding substance misuse and excessive use of social media, and surrounding themselves with supportive people. And how can we help them? That's a good question. See, first of all, we have to be really supportive. We should remember that their gender isn't our call to make, and knowing what to say or not to say when we are around them. If we accidentally use a wrong pronoun, we need to apologize. We need to treat them like any other friend, and we can identify a mental health care provider who can help them if we can. Okay.
Thank you so much, ma'am. Any last message to our audience?
Yeah. See, as human beings, our main contribution is to help create an inclusive society. Let us all strive towards being non judgmental towards people's choices. This is what everyone needs, to be loved and cared for as they are without having to hide or change to fit into the society. Thank you so much. I would like to thank our parent institution, Rajarajeshwari Medical College and Hospital, for always being supportive, and IAPSM for this wonderful opportunity. Thank
Thank you
you.
so much. Thank you so much,
Thank
ma'am. It
you.
was really nice talking with you, and I hope that everyone get aware of this mental disorders and help the society in this way. Thank you so much once again for having a talk with
Thank
us.
you. Thank you, Ritu.